Hi, welcome to Talking Brains, a podcast about mental health, books, and what makes brains happy. I'm your host, Dr. Stephanie Sarkis. Hello, everyone, and welcome to this fourth season of Talking Brains. I appreciate you listening in. This episode, we have a popular returning guest, Dr. Ari Tuckman. Ari is a psychologist and certified sex therapist, and we are going to be talking about a new CDC study that was conducted in June showing that people that are 18 to 24 years old have a higher rate of anxiety, depression, and suicidal behavior compared to other age groups. So we're going to talk a little bit about that. Even if you aren't an 18 to 24 year old, or if you don't have an 18 to 24 year old in your household, I encourage you to listen because we talk a lot about the current stress we're facing, why it may impact certain age groups more than others, how we can practice good coping skills, how to best deal with an increased anxiety and depression, and overall how to practice better self-care and self-compassion. So I think you'll really find it to be enlightening for you, hopefully, and I hope you all are doing well. And I'm going to tell you a little bit about Dr. Tuckman. Again, he has been on the podcast a few times before, and just a great person all around. Dr. Tuckman is a psychologist and certified sex therapist in private practice in Westchester, Pennsylvania, where he specializes in diagnosing and treating children, teens, and adults with ADHD, as well as couples in sex therapy. He's appeared on CNN, National Public Radio, and XM Radio, and has been quoted in the New York Times, USA Today, the Washington Post, the Boston Globe, USNews.com, the Daily Mail UK, and many other media outlets. He is a former board member and current conference committee co-chair for CHAD, the National ADHD Advocacy Organization. He is the author of several books, including ADHD After Dark, Better Sex Life, Better Relationship, and also More Attention, Less Deficit, Success Strategies for Adults with ADHD. He also is a frequent author for ADHD-related publications, including Attitude Magazine and Attention Magazine. His Sex Matters blog on psychologytoday.com covers general sexuality topics as well as how ADHD impacts sex and relationships. And Ari's website is adultadhdbook.com, adultadhdbook.com. Enjoy the episode. Welcome back to Talking Brains podcast. I'm here with Ari Tuckman, PsyD, and Dr. Tuckman's been on the podcast. I think this is your third or fourth time on the podcast. I think fourth. We've talked about ADHD and sex life, and now we're going to be talking about a CDC study. There's a Center for Disease Control and Prevention study, a survey that was taken in June, and it found that 25.5% of adults aged 18 to 24 said they had seriously considered suicide in the past 30 days, and that age group, above all others, had the highest level of anxiety and depression respondents, 62.9% of those 18 to 24. There's also a significant increase in anxiety and depression in this age group since 2019. And also in another study of college students, 91% reported moderate to high levels of stress, and 39% reported moderate to severe levels of anxiety, and 53% reported moderate to severe depression. So Ari and I are going to talk a little bit about why we think that might be happening and how that particularly relates to you if you have ADHD. So welcome back to the podcast, Ari.
Well, thanks. It's always fun to hang out.
Yeah, and we get to hang out and talk about anxiety, depression, suicidal behavior.
I know, exactly. Yeah. So no wonder my caseload is so busy.
Yeah, I don't know if you've noticed since the pandemic started that I'm seeing probably double the number of people I usually see. I don't know if you've been noticing the same thing.
Yeah, no, I've definitely been busier. After that initial dip in March where everyone was like, oh my God, what the hell's happening?
Right.
And everyone just sort of hunkered down for a couple of weeks. Yeah, ironically, just a couple of days ago, I kind of ran the numbers and I've seen about 15% more in this, March to September than I did a year ago. So yeah, there's definitely a higher demand. I think it's also, frankly, that it's easier to do stuff online.
Right.
If you don't have to schlep in, the logistics make it easier to squeeze in an appointment at like 2 p.m. or whatever.
Right.
So yeah. So I think some of this is access, and that's certainly a good thing. But also, unfortunately, there's also, I think, a greater need.
Right. And how do you think, like for 18 to 24s, what do you think is happening that there's been such an increase? Because when the CDC survey was done, this was just done in June. We're still at the peak of the pandemic, but it was going pretty strong in June. So what do you think you attribute that increase to?
Yeah, I think I mean, I think it's just the obvious, like
Mm-hmm.
they're stressed out, they're uncertain, they're a little bit scared, they're not really sure what's happening. Like whatever you think is happening today, who knows exactly what's coming? I sort of feel like, for every one of my either, K to 12 or college students that I've been meeting with, especially like in the last month or so, every time we meet, I'm like, hey, so what's the deal with school? Because whatever the deal was 20 minutes ago could be completely different this,
Mm-hmm.
20 minutes later. So, I think it's just that big uncertainty. But I think probably what is not uncertain is, yeah, it's going to suck more than last year. Like this year will not be as good as last year was. So, I think that is the only certainty in all the
Mm-hmm.
uncertainty.
Right. Right. I think the uncertainty, especially, and that's what I'm hearing from people too, is that, well, yesterday the kids weren't required to wear masks at school, so parents picked the online schooling option. Well, now the county says they have to wear masks, so maybe the kids should have gone back to school, but now I'm working my full time job and teaching my kids online. So there's a lot of uncertainty, a lot of parents kind of reaching the limit of their capability. And for 18 to 24s, I've also noticed it's either I'm at home and I don't want to be at home anymore, or
No,
I'm at
no offense,
school.
mom and dad.
Right? No offense, mom and dad, but
No
you've got
offense. You're not as fun as my friends in
right,
parties.
right, yeah, yeah. We just don't party like I did in college. Um, but and then I see that now I've got students at college, and their roommates are going out and partying and not obviously not wearing masks, or they're pretty terrified being on campus. So I don't know if you've noticed that too. It's like either way, you have issues.
Yeah. Yeah, I mean, I think there's this big push pull because, there are those students who are trying to take it seriously and be careful. And then there are the students who are, just frankly just don't care. They're like, this is stupid. It's not a big deal. Who cares? In that sort of young person way of like, my actions don't have any impact on the rest of the world. This is just about what's easy for me.
Mm-hmm.
So, I think that, so you have that camp as well. And I think that there are students who feel torn in between. Like, if I don't go to the party, what are my friends going to think? If I don't go to the party, that means I'm sitting in my room by myself. Like, that's fairly awful. And yet, if I do go to the party, like, then what happens? And, am I contributing to the college being shut down and everybody getting sent home? So, yeah, I mean, there really is this kind of damned if you do, damned if you don't kind of situation for them.
Right. And then you've got students that have to be on campus because they're doing research and whatnot. So do you have the option to even go home?
Yeah.
And that gets to be an issue. Or if your home is overseas.
Yes.
And did they change the ICE directive? Remember they were doing the ICE directive that if you didn't, or I think was it ICE that if you did online classes, you had to go back to whatever country you were from.
Yeah, I don't know how that actually worked out. It seems like in this administration, terrible things get announced and then sometimes they don't go through and sometimes they do. Like
Right.
who even knows, and is it just for the scare tactic or is it because of incompetence they can't pull it off or it's not actually legal or allowed? It's kind of hard to say.
Yeah, I think that's a big part of it too. Is that we're always hearing different stuff. There's always a new crisis.
Right. Yeah, no, I mean, absolutely. And, I mean, not to get too political about this, but,
Oh, that's
let's
okay.
just say there's one of the parties, one of the candidates for president is, let's just say, not a soothing voice in these troubled times.
Right.
And it's simply not that he lacks the soothing, it's that he actively promotes the discord, the discontent, the worry,
Mm-hmm.
the fear. Um, so like that is very much part of his playbook.
Mm-hmm.
And, like, I mean, God, how many times have I turned off the news at the end of the night and I'm like, great, well, that's what I'll be obsessing over as I try to fall
Right.
asleep tonight,
Right.
so, yeah.
Right. Yeah, I know, I follow Rick Wilson on Twitter, and he's written a few books about this administration. His comment is, "This is going to be an insane week," and I'm like, "Which week is not insane at this point?"
Yeah, exactly.
There's always something coming out. So I wonder how much that's impacting the 18 to 24s. Because I know the usual thing that you hear is, "Oh, well, they're politically apathetic." I found that they're very politically active.
I agree. Yeah. and especially these days, I mean, you think about kind of Black Lives Matter, if you think about LGBT rights, environmentalism. I mean, there's definitely a lot of kind of activist energy within the younger folks these days. So yeah, I agree. I don't think that they are, as apathetic as perhaps they used to be.
So we've got the whole pandemic piece, which is huge. And then we've got the governmental / political piece. And then going back to your family of origin for school, which may be the reason why you left for college of ways away is because you had some dysfunction in your family. And then we've got kids that also have ADHD. And I say kids because, they're 20 years plus younger than me now. Because our 18 to 24 just passed when dinosaurs roamed the earth. So Ari and I are both out of that window. We're in like 2 demographics above, I think. So I wonder too how much being ADHD and having to do all online school is throwing a lot of kids off.
Right. Yeah. I mean, I think so first of all, for any college students, college students tend to run on a bit of a later schedule than their parents do, and that's just, I think there's biology there in terms of like circadian rhythms and whatnot. So like that alone is disruptive. And, there are those sort of arguments about, people the young adults banging around late at night, waking up their parents, the parents complaining about the kids sleeping too long, so there's those battles. But especially when those students have ADHD, I think it tends to be even more so. And, if you leave a bunch of stuff around, you're living with like 3 other 20-year-old guys, maybe nobody really cares. But like your mom, dad probably do, So what wouldn't be a fight back in the dorm or in the apartment with some of your buddies, becomes this like perpetual tug of war with your parents when you're living at home. So yeah, I mean, there's definitely that family dynamics part of it that makes it a whole lot harder, and that you just can't go out and see your friends. I mean, obviously we're all social creatures, but especially young adults, teens and young adults are really social. So to be cut off from all their friends, and not just because you can't see them across town, but especially if they're college friends, they could live 15 states away, other side of the country. You cannot see them. You can't just pop over, even if your parents would let you.
Right. And watching them on Zoom only does so much. We're missing that face-to-face contact. And then we've got the whole issue of frontal lobe maturation, that even if you don't have ADHD, you're kind of supposed to make mistakes in this age group because you still have some impulsivity. Then you add the ADHD piece to it, which is 2/3 of the frontal lobe development of someone without ADHD. And now you've got the impulsive nature. And like you said, that you have not had your parents' rules. Now you're back in the house trying to follow some rules that you have now acclimated to your independent living rules. And I could see where that can create a lot of kind of chaos at home. On top of, you've got, your family and maybe barking dogs or whatever while you're, listening to, an online course, and then accommodations too. That gets tricky.
Right. Yeah. I mean, that whole issue of accommodations has been a real, well, I wasn't going to say question, but it's not really a question. I think has become a real clear problem in terms of like, how do you do accommodations when you're, doing it over Zoom from home, or doing like self-paced remote learning. So yeah, a lot of the accommodations that were so helpful for, students with learning disabilities or ADHD or other physical disabilities are just not as available when you're doing them from home. So, that certainly adds to the stress as well.
Or even just your internet connection.
Yeah.
What if you live somewhere that just doesn't have great internet? I mean, and everything's done by internet now. So what are some tips you would have for college students, maybe specifically college students with ADHD that are going through real heightened anxiety and depression, maybe some suicidal thoughts?
Right. I think the first big thing I would recommend is keep in mind that this is not forever. It feels like forever. Like it totally does. I don't remember a time when, it wasn't like this. And frankly, when we were watching a movie last night, I was like, oh, look at all these people walking around in public without masks. That's weird.
I was seeing something like that. I was watching something like some YouTube video or something. I'm like, those people are sitting next to each other without masks on. And it was like from like a couple of years ago. I'm like, how wild that was that we were doing that. Like you would go to concerts with people without wearing masks. That's crazy. Yeah. Exactly.
Mm-hmm. Yeah. So you get this like knee jerk, like, oh, that's weird.
Right.
So it feels like forever, but it isn't forever, and it will not be forever. I mean, let's all be honest, there's no way in hell we're going to have a vaccine ready by November 1st, as somebody has promised. So somehow, it's not going to be November, but hopefully it's not next November. We'll get through the fall, we'll get through the winter, and hopefully, fingers crossed, we're in a better place at that point. And, we have an effective vaccine that gets widely distributed and life begins to kind of creep back into normal. Or even in the absence of a vaccine, and this is important because the vaccine, is a bit of a gamble. There's no guarantees we're ever going to have an effective vaccine. If we have an administration that takes this seriously and enacts other measures, it creates a situation where the virus load drops down to a point that is like the rest of Europe today, that, they can do indoor dining in restaurants, and they can go to the gym, and they can go to the movies. And, so it's sort of, you can do those things if you pay your dues a little bit by doing things like wearing a mask and other things. So as a society, we have to take it a bit more seriously. And so even again, without the vaccine, there is hope for the future. But I think that, what happens when we're depressed, and especially what happens when we feel suicidal, is we lose that idea that, wait, there is a better future for me. The thing about suicidality is it's not about feeling depressed, it's about feeling hopeless. Not only does it suck, but it's not going to get better.
And yeah, just because it doesn't feel like it's temporary right now doesn't mean that it's not temporary. It may not be the temporary we want.
Yeah.
And we were told that by now this would be kind of abating a little bit. And I think that's what I've noticed, is this kind of a second wave of anxiety and depression in people, because now we've reached that point that we were told that things would be better by now.
Yeah.
And now we're looking, I think Gates Foundation said the best guess for when a vaccine is going to come out is middle of 2021. So, but again, this is going to be temporary. There may be a time where we get to the point where we can't really fathom how long we wore masks, but it is temporary. Your situation at home, if you're living at home, is temporary. Even if that feels like it's going on forever. Yeah, your ADHD may not be temporary, but there's also things you can do to take care of yourself.
Yeah, absolutely.
Yeah.
So, I mean, I think it's important in a situation where we feel powerless. I think it's important to feel like you can exercise the control that you do have. So there's a bunch of stuff I can't do, but what can I do? Within the realm of options, what can I do something about? That's where we need to be kind of putting our focus. I know that's kind of easy to say, but, so maybe you can't see your friends in person, but, you can do, group video calls, or you can, if they live locally, get together outside in, safe kinds of ways. So like there are ways to get some of that social stuff in. And, then it's just the basic obvious stuff of like get enough sleep, exercise, eat generally healthy enough, all that boring, healthy lifestyle stuff, but really is important, and trying to find your fun where you can.
Right. Even if it's in little short bursts of time to have fun. What would you recommend for someone that has to live on campus or near campus and they have roommates that are not following guidelines? Like they're not wearing masks, they're going out and partying, going to bars. What would you recommend for someone?
That is a hard situation. But the thing about it is mask wearing is a social behavior, and, we're influenced by the people around us. So if people around you are wearing a mask, you're more likely to do it. If you're wearing a mask, or if people are not wearing a mask, it can feel more self-conscious if you do wear a mask. So I don't know. I mean, I guess the first thing I would say is just make a point of wearing your mask, like be a good role model kind of thing. Gently ask people, like if they have it down, or if you have it so your nose is sticking out, that's like not having a mask. It's like wearing a condom, but cutting the tip off, It's like, look, I have a condom around my shaft, right? But, it doesn't hold anything in,
Right.
Oh, good. I feel so much better now.
Right. Or I call them chin hammocks, where you wear them as a chin hammock,
Yeah, which makes them completely worthless.
Right.
Like they do not do any good if you're breathing outside of them. So, so a little bit of nice asking. But perhaps there are some direct conversations to be had. We're supposed to be wearing a mask. Like, you're not wearing it. Like, come on, man. This is going to get campus shut down and we're all going to get sent home. Or this is going to keep the virus levels up and then all that fun stuff isn't going to reopen. So to just kind of say it directly. And I know that that's hard, but I don't know. Sometimes doing the right thing is a hard thing to do.
Right.
And then I think beyond that, I don't know. I guess if it really comes to it, you just sort of lay it out there and say, like, look, I can't keep living here if you guys aren't going to take this seriously. Because if you get it, you're going to give it to me before any of us know it.
Right.
And if I get it, then I potentially give it to other people. Like, I can't put myself into that.
Right.
So, and unfortunately, it may be that you need to find somewhere else to live, and that sucks. And that may strain some friendships. But I don't know. I mean, life is hard choices sometimes.
Right. I think that's really important. That it's a difficult conversation, one that you probably have to have, especially if you have a medical condition. So the people I work with have asthma. I tell them, just tell your roommates that you have asthma and you're high risk. And usually if you tell someone that, what I've noticed is that the roommates will automatically start wearing masks and be very careful, because when you have a medical condition, that kicks it up into a new kind of responsibility area, I call it, where they could potentially kill you. So that's something that I think that people maybe should, if they have asthma or another respiratory issue, or if you have a compromised immune system, go ahead and tell your roommates that. They probably should know anyway, just because if you have a health condition, it's probably just a good idea, since you're living with people that they know.
Right.
But I found that that's quite effective if you disclose that. But yeah, I have seen that quite a bit, where you have people out partying, and I think it depends on your state too and what your state rules are.
Yeah.
So that plays into it too. And I think that's part of what people are picking up on too, is that it's hard to tell what rules apply where, because like we talked about, that things change so quickly.
Yeah.
So my default is just wear a mask and practice social distancing. If you don't know what the rules are, just like you said, wear a condom. Just don't wear it once every 5 times. Wear it every time. So
yeah. Well, and it's it's a hard thing, because like, as humans, we're always assessing risk. Like, is it worth it? Is it too risky? Is it acceptable levels of risk? So, I mean, every time you get in the car, you're accepting some risk. Now, if it's a normal day and you haven't been drinking, it's probably an acceptable level, and you're like, yeah, it's worth it. Now, on the other hand, if it's like crazy rain, or it's like, icy and slick and snow, you may say, yeah, I think I'm going to stay home today, or maybe I'll pass on going and getting a slice of pizza. I'll just make something here. So, we assess risk, and that's generally good. But I think, what's hard in terms of coronavirus is people are not good at assessing the risk, because the problem is people can be contagious for days before they know it. So, it's like when HIV was a bigger deal, not that it's gone, but it's this thing of like, well, they looked like they were, healthy.
Healthy, right.
Right. So therefore I didn't use a condom, right? Which is ridiculous, because most people who had HIV looked fine. It doesn't produce sores or, other things that you can see and go, oh, well, with this person, I'm going to wear a condom. So, but also the issue is, if you have, a local area with a really low infection rate, it doesn't mean that there will be no infections. One person comes in, one person gets exposed, brings it in, and the whole group gets it.
And that's it. Right. Like we've seen with family gatherings, weddings. I think there's a funeral where it turns out like 20 people got sick from going to one funeral. I think half of them died. So, I mean, we really need to be careful about things that we don't think are a big deal. Like, if you're pretty sure that your neighbors have been socially isolating, but you get together with them, you don't really know that.
Right.
You just don't. So that's something we need to take into account, is that we'd like to think that everybody's in the up and up and everybody kind of tells the truth about stuff, but some people aren't going to tell you that, hey, by the way, I went to this bar the other day,
Yeah.
So we have to be really careful regardless. But what would you say for people that are like maybe at home and battling some suicidal thoughts?
If it feels like more of a struggle than it should be, then reach out, either to a friend, to a family member, to a mental health professional. I mean, one of the good things about the pandemic, which is kind of a weird thing to say, but there are some good things that have come out of it. People are doing a lot more, telemedicine or
Right.
teletherapy or whatever.
Like
So
you and I are doing exclusively
yeah,
teletherapy.
and it makes sense because, I mean, we're not dentists. Like you can't do telemedicine dentistry, but therapy you totally can. So like again, back to assessing risk, like it's not worth the risk of sitting in a room with someone, and it's not simply that I'm worried that they're going to give it to me. I'm also worried that somebody will inadvertently give it to me and I will inadvertently give it to the next person.
Right.
So the good news is, you're only a click away from a therapy appointment or medication or whatever. So again, the access side has gotten better, so at least it's slightly better in that case. It's
Right.
easier to access services.
And if you're a college student and you're kind of low on funds, there are people that do pro bono or free counseling and sliding scale. And the good news is because everybody's doing teletherapy, you can see a therapist pretty much that's anywhere right now. It doesn't have to be in your local area. And
Right.
there are therapists that specialize in seeing your age group too.
Yeah.
So,
Well, and also, if you're a college student, I'd encourage you to find out what your counseling center is offering.
right.
So, um, there's a lot of people who could see me today that couldn't see me in the beginning of March, because they would have to drive here. So, and, insurances have become more sort of flexible in terms of like, paying for online therapy. And there's even, and this is sort of shocking to me, but there are even some insurances that have actually waived copays for doing therapy sessions online. So, that's kind of amazing to me that they did that.
They're being proactive.
Yeah, probably
Wow.
the bean counters figured out, whatever
Right.
we're, having to fork out in copays is less than, a few hospital stays if a few more people get COVID. So,
Right.
I don't know that it's pure, social good there, but
Yeah. I
whatever.
mean,
We'll take
insurance
it.
companies and altruism usually don't go together.
Right, right. But I don't know, maybe they also ran the numbers and realized, what? A little bit more outpatient therapy is not that expensive compared to, the alternatives.
And then what would you say for people that are dating? Because I co-host a podcast about, it's called Nerds in Love, and it's for millennials with dating issues writing in. And one of the biggest questions is, how do I date during a pandemic?
Yeah.
And since you're a sex therapist, certified sex therapist, what advice would you give to people that are kind of at the point now where they're like, this is enough, I want to go out and meet somebody?
Yeah. It's hard. Like it just is. Because, truthfully, you shouldn't really be getting together with people. Like we're not supposed to be doing that. The good news is you can easily meet people online, and obviously that's completely safe. The hard part is when you meet people online, you just don't have the history with them. And are they really honest about what they're doing? Like, you don't know. But if they're a friend of a friend, you could, if they're in your social group, you can ask a mutual friend and say, like, hey, so I've been talking to, what's their face? And, here's what they're saying. What do you think? Does that sound about right? And, your mutual friend can say, oh, yeah, I've known them a long time. Yeah, no, they're a straight shooter. Or, yeah, you may not want to believe everything you hear, right? But online, you can be anybody you want to be. So, like, are they being smart and safe? Hard to say. So I don't know, like, this is so reminiscent of the whole, like, AIDS crisis and safe sex and condoms and that whole thing of, like, to have unprotected sex with someone, you both need to, like, get tested and swear that you're going to be monogamous,
Right.
And there's very much an analogy here of, like, okay, well, you and I can start, like, hanging out and sleeping over and, fooling around and whatever, but only if you're not going to drunken, stupid bars and things like that,
Right.
So, yeah, I don't know. It's a tough thing. I mean, what are your thoughts on it?
I think it's a assumed risk that you never fully know.
Yeah.
The only time you know for sure is if that person's living with you. And even then, I mean, meaning like if you're quarantined, you've been around each other 24 hours, you know that people haven't been out places. But I think it's also normal for 18 to 24s and older that, like you said, they're social creatures. And when you're at that age range I think it's easier to kind of feel like, well, I can't see it. I don't know anybody that's sick, like you said, so it must be okay.
Right.
And all these other people aren't wearing masks. So yeah, I've been telling people, do the online route, online dating. Like you said, have somebody vouch for the person, and just assume that the person's been to a bar. What would you do? Request that they get tested, because there are a lot of states and counties that will test you even without symptoms. Again, it depends on your area. And then also look at the aspect of, can you date and just keep social distance? Which means you're not having sex, but maybe you can go to a park or something and just maintain distance and wear masks. I mean, that's not fun. It's not what we typically think as a date, but that's kind of the time we live in right now.
Yeah. Yeah, I mean, it is. So I don't know. I guess you need to balance the risk and the reward, which is exactly the same thing as having unprotected sex in other ways. Certainly there's a lot of exciting rewards, so to speak, in dating new people and all the things that come of it. But yeah, I mean, there is a risk, and it may be one of those things you need to take into account. Well, what are my vulnerabilities in terms of, like, do I have pre-existing conditions, but also who are the people I'm interacting with? Who do I live with? Do I see my parents who are a bit older, or my grandparents? Who do I work with? Who else do I come in contact with? What are the potential repercussions there? So, I have a client who has a daughter in this age group who, works in a dental office. And if she gets exposed and contracts it, like that's an issue for the whole dental, like they could close the office as a result. Is that going to lose her job? Maybe. So it's sort of, you need to kind of weigh your specific factors. By contrast, I suppose if you're living with a bunch of other 20-year-olds and nobody's really going anywhere, and like, I don't know, I'm not going to say that's okay, but I suppose the risk is relatively less.
Yeah. Yeah, I think it's what's your acceptable level of risk? And like you said, I think it's really important to look at, are you around people that are 65 and older? Are you around people with health conditions? In that case, you may just have to kind of lock down your dating life for a little while.
Yeah.
And the consequence of that is that at least you're not getting your family sick, because it's better to not go out on a date than live with the guilt of getting someone in your family sick.
Right.
Yeah, and I think that's really important about the workplace too, is that you could be out of a job. That places are shutting down really quickly, especially like in the restaurant industry, when one person gets sick. So there's that piece of it too. So you have to think about all the other people. It's kind of like that thing, with AIDS. And I think a lot of the 18 to 24s, weren't around when AIDS was. It's still a health crisis, but when it became huge as a problem, the rule was, well, whoever you sleep with, you're sleeping with whoever they slept with. So it's kind of like, if you think about that with the virus, that if you're around people, you're around everybody that they've been around. And so you have to look at it that way too.
Yeah.
How many more people are you impacting? Right.
Yeah. I mean, absolutely. And, like that was definitely the thing when AIDS was like really big and scary, is, you're sleeping with the people they're sleeping with and the people that they slept with. Mm-hmm. So first of all, my number is going to be a whole lot bigger. So that's cool. But also, but, I mean, depending upon if you have a job working in a restaurant or something like that, there's a lot of these businesses that are really struggling. Mm-hmm. Like they're barely hanging on, or they're hanging on now. But in those parts of the country, like here, where it's going to be a whole lot less pleasant to be sitting out in November, and certainly December, January, February, March, some of these restaurants and these other businesses are trying to make as much money as they can right now, because however bad it is now, it's going to be terrible. So, for them to have to close down for a week or two could be disastrous.
It's devastating.
Like you could take down the entire restaurant.
Yeah. Not to increase your anxiety or depression, everyone.
Right. Exactly.
But it's taking responsibility. So and in wrapping up, what's a piece of advice that you would give people in this age group that's having such a much higher rate of anxiety, depression, and suicidal thoughts and behavior?
I think it's acceptance. Accept this is what it is. I'm going to try not to, be angry and rail against it in the sense of like the things I can't change, but rather, what are the things that I can do something about? Where are the places in my life that I can have some influence? Where are the places that I can, I don't know, do something fun, reach out and connect with people, have interesting things going on? I might throw a pitch in for voting as, a way to feel like you're having some impact on things.
Mm-hmm.
So feel like you have some agency in that you're
Right.
not sort of powerless and adrift in a boring, crappy world.
Right. Yeah, I think that's really important. I would also recommend that people read Viktor Frankl's Man's Search for Meaning, about making your own choices in life and knowing that you still have control over some things, even if it's just your attitude about things. And yes, vote and help get the vote out and fight voter suppression and all that stuff that's, kind of creeping up on us and has been. Yeah, and it's temporary. It doesn't feel like it's temporary, but eventually it'll be temporary. So,
yeah.
Well, thank you very much. I appreciate it.
Well, my pleasure. Thanks for having me back on.
Thank you again for tuning into this first episode of fourth season of Talking Brains. I appreciate it, and especially a thank you to Dr. Ari Tuckman for appearing on the podcast again. Again, his website is adultadhdbook.com. That's ADULT-ADHDBOOK.com, and that's Dr. Ari Tuckman. And I'm Dr. Stephanie Sarkis at stephaniesarkis.com and the author of Gaslighting. Thanks again for listening. Hit the subscribe button and rate the podcast. It's appreciated, and have a wonderful day.